Susan is a nurse who is a health and wellness coach who trains other nurses in how to help their patients deal with some of the issues that they're having from basically any type of medical thing, not just strokes. But Susan also has a unique perspective because she's also a caregiver of somebody with aphasia. So I thought it would be great to talk to Susan and kind of get her idea of how she deals with someone who's a loved one with aphasia who has a lot of anger about it, because that seems to be something that does come up with a lot of people where they're very angry kind of about their situation and they tend to take it out on other people. What would be your advice or something that you would tell other caregivers or just people in general about dealing with somebody who's very angry a lot, especially somebody who has aphasia?
So it has been difficult at times, as much as I tried to discern between what might be occurring because of the stroke and brain involvement, and how much is emotional and frustration and being the person closest to the affected person, how that's taken out on me. So the challenge is, how do I, as best I can, separate myself? And for anybody who's going through this, how do I first of all take care of myself so that I can not take on all of that anger and have it wear on my own well-being, and also my reaction and response to my partner, because that's not helpful. And we're only human. I'm only human, so sometimes it's easier than other times. But I find that if I sleep well, I eat well, I make sure I take a morning walk, if I can take a yoga class, these are my own personal ways of coping, and that I know I'm doing something for myself. And then when I come into the situation with Bob, I'm more able to, first of all, be calmer. And my belief system is that my energy affects his energy. So if I'm frazzled and I'm stressed out, he picks up on that. He's a very sensitive person. And maybe with aphasia you become more sensitive, just like sound and light. He says, don't open the curtains in the morning, or talk lower. I see that the senses are very affected. So I imagine that the environment is also affecting his perception of calm. I love what happens here at the Aphasia Center, because when he's calm, he speaks better. This is just a little segue.
Right.
So he has a card that says, take a big breath, drink some water, swallow, and then speak. And we tried it last night. He was trying to say something, and it worked. And somehow those cues, so if those are cues on cards, I imagine the cues are the same from a human being. So if I can say to him, can you repeat that again? Rather than, I don't understand you, because I'm frustrated by his frustration, and it becomes an energetic kind of interaction. So my first advice would be that we have to take care of ourselves. The card that he has, breathe deeply, I have to practice that too, honestly, because it makes a big difference. If I feel my nervous system is calm, it's going to affect my interaction with him and his response to his stress and to me.
And do you feel that it's something that you said, being the closest person to you, so it's kind of like you're the convenient one to take it out on. And I understand that, just from being a person in general with your family, where as the safe person, you are the target.
I might even say, I understand you're angry and frustrated. Let's try to find a way that I could understand you, and you can try to help me. Help me figure out what you're trying to say. So can you write it down? Can you spell it? Is there a way that I can understand better? Sometimes.
And anger and depression kind of have this flip side thing because there's the idea that anger directed internally kind of turns into depression. So you kind of have a lot of times when people are talking about coming here, or they'll say, oh, so and so is really, really depressed. And I've seen a couple of people in the entire time I've been doing this who are really, really significantly clinically depressed. So there's a difference between depression and sadness as well. And so for most people, this anger also has kind of like this element of depression, or like where you say, where it's kind of a cycle. So you're angry that you can't do something, but I see a lot of people who come here who are kind of described as that once they see that they can have some communication success, a lot of that tends to go away or significantly decrease because they're not kind of caught up in this whole cycle again of frustration and not being able to do something and not getting anywhere with it, and then kind of internalizing all of that, and just kind of perpetuating it. But I think one of the things you said that was really, really important is, you can't approach somebody who's kind of in that anger, depression mindset unless you've had enough sleep. If if you're coming at it kind of like in the middle of all these other things that you're trying to do. And I definitely relate to you saying, here you're thinking, I've done all these things and you are so ungrateful. I can't believe I've given up all this stuff and I do all of this stuff for you and you're still angry at me like I haven't done enough and that this is all my fault and it's not fair type of thing.
And I think it's really important as caregivers that we do step back and we say, this isn't about me. He's not really angry at me. He's angry. He's angry that his hopes in retirement for another life cycle of a full life of travel and financially being more stable, all of that has been cut short. And he's angry that he can't communicate, maybe with, again, his grandson. And so, but to turn that around as opportunities and as an incentive to really work hard, and he knows and understands before his stroke about the whole but science of neuroplasticity. And we draw on that a lot. That you can create new neuronal pathways, you can create new circuits so that you can compensate for where your deficits are. No, you may never be a conference speaker as you were before, but you could still certainly have social interactions and be able to communicate better. I also want to just say, when you were speaking about sadness and depression, I think one of the things that happens is people move into a feeling of, I don't know if it's clinical depression, but they move into this feeling of helplessness and hopelessness. And that's another piece of how do you turn that around. I'm the eternal optimist, so I'm always the glass half full. That if you feel helpless, what do you need to do to feel more hopeful and move forward in that way? What would give you hope? Is it being able to have a communication with your child, your daughter, or would it be being able to send that email independently to someone who's corresponding with you? And it happened today here at the center where he came out and he had just completed a lesson and it was difficult to understand at first, and I said to him, give me one word. He was trying to say that he succeeded in whatever it was he was doing 100% without having to look at the words, and he was able to repeat the sentence, maybe write the sentence. And I mean, that's something that I'm going to draw upon when he goes back to feeling helpless, to say, remember when you did that? Well, if you did it once, you can do it again. And really help that person move from in the moment feeling helpless or distraught to the possibilities. If you do it once, it's possible to repeat it. And I think there is a piece that is important to also consider, and that's for both the caregiver and the person affected, is the entire lifestyle component that affects and impacts the progress. So I'm thinking of how stress affects the brain, how nutrition affects the mind, and the body, how sleep is so important.
Oh, yeah.
Because for all of us, I mean, if you're not sleeping well, it's hard to focus.
Mm-hmm.
And if you have aphasia and you can't focus, it's harder for the words to come out. And again, I could speak for Bob, that when he has a good night's sleep, he speaks better.
Mm-hmm.
When he has had a restless night, and for whatever the reason, he's not focused the next day, and he's more frustrated,
Mm-hmm.
and he's more angry. So it's hard to separate out all of the components and how they impact. So I would just say, for caregivers, for ourselves, for our own self-care, and also for thinking about what's the environment for that person. You know, are they watching the news before they go to bed, or, you know, have 10 different lights on in the room? You know, do they need a sleep mask, or, you know, lavender aromatherapy, or, you know, really comfortable bedding? All of this really, if you go online, you can look at sleep tips.
Mm-hmm.
And I think that sleep is probably one of the most important pieces.
It really is, yeah.